Rima Dalal, from owner and founder of Vital Energy, Occupational Therapy, Physical Therapy and Wellness Center in Columbia, South Carolina. We would like to share our experience with treatment of renal cell carcinoma patient, Mr. Norris, who also had a mets in lungs and was on a chemotherapy, and how the chemotherapy side effects was starting to build in, and his journey, how things changed in his lungs and the mets almost disappeared. And Mr. Norris, you want to tell that what type of a cancer you had and how long, and what type of chemo you were getting, and with what intention?
Okay, I have a renal cell carcinoma, otherwise known as kidney cancer. It metastasized to my lungs, and I actually had small tumors in both sides of the lungs. And through a little bit of the chemotherapy treatment and along with Vital Energy, I've been able to shrink some of the tumors, and although they're still present, they are currently shrinking, and my energy level has returned to almost normal status.
And were you able to avoid any side effects of chemo, would you say so, while receiving the energy treatment as well as cardiovascular treatment here?
Yes, I was a little bit. I'd come in, sometimes I feel pretty bad when I got here, and I would definitely feel better when I left.
What about the burning and in the hands and the sensation issues that we were?
Mine was mostly in the feet. I did have them in the hands as well, but feet were my problem. I'd get a burning, almost like calluses on my feet, and they were pretty painful.
And since we started doing treatment with the energy work and crystal myofascial release and aqua detox and pool therapy, did that help you decrease that?
It did. Yeah. It definitely did.
Mm-hmm. And your energy index always rised up, right, after the treatment.
Right.
Ms. Norris, would you like, Ms. Norris is also a registered nurse and has been very important person to help you do the comprehensive integrative medicine approach for this treatment, correct?
Right.
So she would like to add that what sizes the mets were and what it did.
Well, the kidney cancer started out with 11 centimeters, which is large enough to be for a baby to be born. It's a pretty good size met. Well, cancer, and then the mets was in his lungs. He had right now, after the treatments that he's received, the targeted therapy that he's getting, the targeted therapy, and also his diet, I think, is also imperative that he eats an organic diet. His ultimate goal is to get off of the chemotherapy and come to Vital Energy, where he can get the energy treatments, and the exercise, I think, is a very important.
What would you say that the chemo doctor, the cancer oncologist, goal was with him?
To keep the cancer from metastasizing any further, other than to other parts of his body.
And I think we have exceeded that goal, correct?
That's correct. His last PET scan showed that the tumor behind his heart has decreased by 3.3 millimeters, which is not a lot, but that was really good. And then the other one have remained the same in his other lungs, and no hypermetabolic activity.
And didn't one or two disappear too, the mets?
I think two.
Yeah.
A couple of them
have disappeared.
So things are looking quite.
And he's not huffing and puffing, I see, and not out of breath most of the time.
No.
Your energy level really looks good.
Right.
So to share what treatment I gave you, what energy medicine does, it's in a cancer, what happens, any type of a cancer, the communication between the cellular system really diminishes or goes away. And the nervous system is also not interacting with the cellular system. Whatever the cause can be, it can be emotional trauma, it can be physical trauma, it can be